hip replacement or before the hip replacement?
Since the hip replacement.
Okay, all right. I'll explain why that is here in a second. Can I have a look at your incision?
It's because I kneel.
Oh, yeah.
You seem skeptical. What is this? How you been?
I've been good.
Have you?
Yeah, no complaints.
Good.
Yeah,
How long you been
life
here
is
now?
good.
5, 7 years?
I actually, on the 5th of this month, I went over the 9-year mark with Dr. Young.
Did you really?
Yeah.
Good for you.
Yeah.
Over here, I can pull it down.
Yeah, I might have to come down. I don't think it's going to get up far enough.
I'm so modest.
That looks good, man. I'm going to peel this last steri strip off there for you.
So you're very gentle. I'm amazed.
If you haven't done so already, you're more than welcome to take a bath, get into a swimming pool, a hot tub, or a jacuzzi. Your skin is sealed. Nothing's getting past it at this
Okay.
point in time, okay? You can go ahead and pull your pants up and have a seat.
What's going on with this pocket?
It's a little hematoma, but it'll go away. But I'll have Dr. Young here. Let me see it one more time.
I had 2 of them. One right above.
You had one above it?
Yeah. It was a pretty good size.
I'll have Dr. Young come in just to poke his head in and have a look at it. I'm pretty sure it's just a hematoma, which is just a pocket of blood. It should go down on its own, but we'll let the boss have a look at it just to make sure. First thing I want to show you, as soon as you're ready to go.
Oh, I better sit down, huh?
No.
You're a nice guy.
Thanks.
And you've been able to keep it.
I try. You can take the boy out of the Midwest, but you can't take the Midwest out of the
Where's the
boy.
Midwest?
Dubuque, Iowa.
Oh, Dubuque.
Yeah.
Kansas.
Oh, nice. Nice. These were taken about a half hour after your surgery in the recovery room. As you can see, there's your new addition right there. This is looking at you from the front. This one's looking at you from the side. Everything is in fantastic position. Radiographically, doesn't get to look any prettier than this, but just as kind of a refresher for you in case you forgot from the knee. Even though you had this done to correct a bad joint, your body still views surgery as a physiological insult. You had 2 big bones worked on to put those parts in, 2 of the biggest bones in your body. So that surgery produces pain and inflammation similar to having your pelvis and your thigh bone both broken at the same time.
Holy mackerel.
Exactly.
I never would have gotten the procedure.
Yep, my sentiments exactly. And if you were to break those 2 big bones at the same time, a month later, you still wouldn't be perfect yet. But you're moving in the right direction. Most people, they're not consistently really happy. They're not rocking and rolling until the end of that 3rd month after surgery. So you still have 2 more months to go just to get to that point. Even then, the new hip is going to continue to improve and get better and stronger and less sensitive all the way up to the 1-year anniversary of the surgery. At the 1-year mark, you'll be as healed as you're going to get. Whatever your results are at that point are what they're going to be. These are copies for your record, so you get to take these and keep these. Now the reason, I'll give you a few reasons why this might be hurting more now. Even though this bone was cut right there, the whole distribution of that bone, which forms the top half of your knee, is going to feel the effects of that cut. So it's not uncommon that after a hip replacement, people will experience some referred knee pain afterwards. That's one reason. Another reason, while this is healing, you're going to make subtle changes the way you stand, move, and walk to accommodate that new hip while it's healing. Those changes in your stance and gait are going to put additional stress and load on other nearby joints. So for you, you just had a left hip replacement, you might have some low back pain, some pain in the other hip. One or both knees might be sore and achy. One or both feet and ankles might be sore and achy. Any combination of them or all of them might be sore and achy during that first 3 months after surgery. That's normal. As that heals more, your stance and gait should normalize, and these additional stresses and loads that are being placed on these other nearby joints should get less, and they should start to feel better. Okay? And then the last reason, if you have arthritis in one or more joints, you probably have it in multiple joints, to include maybe even this knee. And since you made those changes in your stance and gait right now to accommodate that, it might be irritating any arthritis that you already have in that knee. So it's probably a combination of all three of those
Okay,
reasons.
so there's no unusual or
No.
undue.
You know, by the end of the third month after surgery, that should start to feel better though. And if it doesn't, then I need to get an x-ray and see what's going on there.
Okay.
These are copies for your records, so you get to take these and keep these. You can add them to the knee x-rays. The next thing I have for you is a list of notes and reminders. A lot of this stuff is simple common sense stuff, so I'm not going to hit each and every point, but I am going to draw your attention to some of the more important stuff. The first one, inflammation is a normal part of the healing process during the first 3 months after surgery. That inflammation can come and go. You're going to have good days and bad days for another couple months yet, and that's just par for the course. Walking, by far, single best thing to do to rehab that new hip, bar none. So make sure you go for a walk every day.
Well, let me just stay right there for a minute.
Yep.
Tremendous pain can come out of that.
Are you using a cane or a walker?
No.
I think you should be using a cane or a walker, then I'll take some pressure off of it and it won't hurt so much, but we need you to walk.
No, I agree with it, but then I back off because I mean it's a good. I've had a lot of pain over the years.
Yeah.
So then I back off for a couple of days to kind of let it relax, and then I get back.
That's okay. When you get back to it, don't start at the same level you were when you laid off for a couple of days.
Scale back.
Scale back that distance a little bit, and then just gradually, slowly build back up. If you try to push it too hard too soon, it will get sore. So, you know, that's just your body's way of talking to you, saying, you know what, you're doing a little bit too much too soon. You need to scale things back a little bit. And I think if you use a cane or a walker, you're going to take some pressure off of, some weight off of your legs, and you'll transfer some of that force through your arms through the walker or the cane. So it might be a good idea to use one of those if you haven't been. You may not need it. You may be confident that you won't fall, but it's the walker and the cane aren't just to prevent falls. They're also to kind of unload the legs a little bit. So.
Okay.
And then on that third point, you had ice and elevate.
Yeah.
How important is that at this point?
I think it's still important to ice 2 or 3 times a day just to help keep that inflammation to a minimum. It'll make you more comfortable. Ice is still your friend. It's going to be your buddy to some degree or another for another month or two. So I would keep doing it if it was me.
Okay.
Even though you didn't ask for it, I did give you a prescription for out-of-home physical therapy just in case you change your mind when you get home. This is up to you to choose to use or not.
What do you call it?
Physical therapy.
Oh, I said auto.
It's written for 1 to 3 times a week for 4 to 6 weeks. You can use as much of that, as little of that, or none of that as you see fit. Again, the only thing you really have to do for a hip replacement is go for a walk every day, and that hip will be golden by the end of the 3rd month. But you have it if you want it and you choose to use it.
On the rehab work, the ones I've been to have been so mild
Yeah.
that after about the 3rd or 4th one I started going to.
Yeah. To be honest, for anterior hip replacements, I don't really think PT is necessary. I don't think that they know some special style of walking that's superior to some other style of walking that's going to make you heal faster or give you a better end result. Walking is walking. I think PT is really only helpful for those patients that aren't good self-starters, aren't good self-motivators, won't do the things that they're supposed to do, which is go for a walk every day. If you go for a walk every day, you don't need PT. So, but I give it to you just in case.
Scott, you have any commentary, which I think you disagree,
On what?
whether or not I'm getting in as much as I should?
I mean, it's your choice if you
No,
want
but
to
I
walk or
mean,
not.
voice your opinion, please.
I have no opinion.
Okay.
I mean, he's telling you what you need to
Yeah, I'm
do.
not arguing.
Yeah.
You don't still have those white stockings on, do you?
We stopped that.
Okay, good.
Yeah.
Why did you ask that question?
Because I didn't see you when you had your pants down. If you had those white stockings on.
No, the white.
The
pressure.
Yeah.
No. I think your instructions said quit after.
Yeah.
Yeah.
You're done with those. You're
And
done with the aspirin and the Prevacid. At this point in time, you're medically stable. You're at no more risk for a blood clot from the surgery than you were before the surgery. So you don't need those precautions.
So he's still on the PPI.
If he's not taking aspirin, then you don't really need it unless you were taking it prior to surgery. So, for whatever
Which
reason.
I was.
Were you?
Well, you were taking
Or small. or
Raditine, which is like
whatever you were doing prior to surgery, you can resume that or continue that.
Okay.
Your clock regarding the dentist gets reset from the most recent surgery. So I want you to avoid the dentist. No dental until after February 9th unless it's an emergency. Also,
Why the dentist?
because
Bacteria.
yeah, we don't want bacteria in your mouth getting in your blood, going to that new hip and infecting it.
That's how you got the sepsis in your knee, was bacteria.
The risk of that is greatest during the first 3 months after surgery, which is why I want you to avoid the dentist if at all possible until after February 9th. After the first 3 months, the risk drops down a lot, but doesn't go all the way down to zero. It's present at a low level for the first 2 years after surgery. So, for the next 2 years minimum, if you go to the dentist for any reason, even just a cleaning, I want you to take antibiotics 1 hour before. This is a prescription for amoxicillin. I want you to take this to the pharmacy, get it filled, put it in your medicine cabinet at home, and that way when you do see your dentist next, you'll already have what you need.
You know, just a side comment, you know, I came down with a serious infection.
Yep, I remember. Yep.
Was that because of that reason, because we quit using it?
It's possible. It's
Who
possible.
knows, yeah.
Who knows?
It was strep bacteria
yeah.
that got in there.
And actually, even though this says just for the first 2 years, with your history, I
would do it
think it
every
would be a
time.
good idea to do for the rest of your life.
Okay.
You go to the dentist for any reason for the rest of your life. I don't care if it's just a cleaning. You know, if it was me seeing some of the stuff I've seen in the last 12 years, I would do it for life.
Okay.
And people that have artificial joints that have had a previous history of infection, they're at slightly higher risk than those people that get an artificial joint but have never had an infection. So with your history, I would do it for the rest of your life.
Okay.
I think it would be a good idea. Your next appointment is going to be up to you. Basically, if you ever have problems with that hip or the knee, you give us a call, we get you in, we get you seen by Dr. Young. If you're not having problems, if you're happy and you're satisfied, you can stretch that next visit out up to a few years from now. We would just keep both joints on the same schedule.
Okay.
Okay? If you guys ever have questions or concerns, you can always either call us or email us. I think the people that email us are much happier than the people that try to call us, just my own observation, but you're free to do whichever you like. What you got for questions?
You got good verbal skills. How'd you get them for going from that state?
Just
Thank
really.
you.
You're welcome. So hang tight. I'm going to have Dr. Young come up and look at that hematoma real quick, okay?
Okay, good.
All right.